Hi, we're from NST La Jolla, and we're going to be talking to you guys today about an EVD. Sometimes these may be ordered for your patients if they feel like they need to take off some CSF on your patient. Just a number of things can happen. And so typically when these have to be set up, it'll be your mentor or your charge nurse who will be in here usually helping you set up with this. This is typically what they look like. A couple things to know about them is that you want the 0 here to be level with your patient's tragus. Again, this is something that your mentor or charge nurse is going to be setting up for you. But all you do is there's a little level back here. You squeeze this and you can move this up and down to make sure it's as level with the patient's tragus as possible to set it up. And then this tubing up here is what's going to be inserted into your patient's ventricle. This is what it looks like. This part's going to go in, and then here's our patient here. And you're going to insert up here. And once it's inserted, typically the doctor is going to ask you if they can set it at 8 or 6 or 10, whatever they'd like. One of the biggest things you want to ask is, do you want it set to mercury or water? And if they say mercury and they want it at 8 of mercury, right now it's at 8 of water, so you want to move it by pinching these two and bringing it up to 8. It's a little fidgety, you get used to it, I promise. You always want to make sure too with your patient that it's leveled correctly at the tragus. Typically they have a leveler on it. For this one it was missing it, so we're going to be using this cord as an example. But as well as the 0 being lined with the tragus, you also want the level to be lined with the tragus. So you'll pull out the leveler and you'll bring it to their tragus. And typically, like when you're hanging a picture, there's that little thing on top of it that the circle goes right into the liquid right in the center. That's how you know it's level, if it's in the center. Now that the EVD is inserted into your patient, 2 things you want to do is make sure that your EVD is connected to your monitor, and you also want to 0 your EVD. Now by doing that, you're going to move this up to the side. You're going to open up this to air, and then on the monitor there will be a button that you can push that says 0 EVD. And then after it's 0'd, you'll put this back on, and then you'll turn this down. When the drain is draining, it's going to be looking like this. And then every hour, at least every hour, you need to get an accurate ICP measurement. And in order to do that, you want to turn this up towards the drain. And then the settings on the screen will start to give you an accurate ICP measurement. And once you get that, you always want to remember to turn this back open so it can still be draining into the chamber here. This drainage chamber is going to be used to chart how much you're getting out every single hour. And then you also want to make sure that every hour, once you mark how much is out, you drain it into the bag. And by doing that, you're just going to turn this 1 notch to the side and let it drain out into the bag. A big step too here is that if the bag is starting to get too full, you want to make sure it's changed. And that's a sterile procedure only done by either your mentor or your charge nurse. And now also the doctor may ask for a sample of CSF. In order to do that, you're going to pull from this port, but you want this turned all the way down. And then again, your charge or your mentor will do this, but they'll typically use a CHG swab to clean off the area and then withdraw the sample. And then always want to make sure, in order to keep it going, you just flip it all the way back up after. One of the most important things as your job as a bedside nurse is to make sure that if you're going to be doing anything that involves movement with your patient, or your patient's coughing or RT is going to suction, you want to make sure that your EVD is clamped in order to make sure that it doesn't drain too much CSF. And by doing that, you're either going to turn this off to the patient, or let's say you're at the head of the bed in an emergency situation and you can't get to your EVD in time. There's also a clamp at the head, and you'll turn this here off as well to the patient. Those are 2 different ways that you can clamp. Now when you're looking at how much you want your ICP to be draining an hour, the typical person produces 10 cc's of CSF an hour, and typically there may be an order to not allow for the patient to drain maybe more than 20 or 25 cc's an hour, and if they're starting to hit that threshold, you can always clamp it. And then when you're documenting what they're draining, you also want to document what it looks like as well, because typically CSF is clear, but with certain patients, if they have a subarachnoid hemorrhage, there may be blood in the CSF, and that is normal, but we want to make sure that there's not an abrupt change with what it looks like.